Hello, folks. My name is Matt Herdman with Protect Our Care California. I'm Protect Our Care State Director here, fighting the huge fight to protect Medicare, specifically Medi-Cal in California, from the aggressive cuts that House Republicans and Senate Republicans are pushing right now. We're here today at a press conference to talk about Kevin Kiley and David Valadio's role in massive healthcare cuts that would affect hundreds of thousands of their constituents and millions of people throughout California and the rest of the country. So right now, House Republicans have already passed these very steep Medicaid cuts, the largest in history, and is currently being debated in the Senate, though it will have to go back to the House for final passage. These cuts would devastate California communities, especially in the Central Valley and the Sacramento area, exactly where these folks represent the most. So I'm extremely pleased to be joined by Congressman John Garamendi, who's been one of the strongest fighters to protect healthcare in the House. He's someone who helped pass the original Affordable Care Act and has been a stalwart defender of healthcare throughout his time in Congress and also in his time in public service in other roles in California. We also have Dr. Roy, who's a physician and cardiologist from Southern California, and Dr. Jean Ravan from Davis, who's a physician. We're going to talk about what these cuts would mean for their patients and for folks throughout California. At the end, we'll have time for questions. So if you want to start using the Q&A feature, just get them in now or throughout the presentation, definitely start on that. And with that, I'm going to introduce Congressman John Garamendi.
Thank you so very much. It's really important. I'm not sure it's a great pleasure to be talking about what is actually going to happen here in Washington, D.C. In fact, it is frightening and very, very troublesome for Californians and really across this nation. My involvement in healthcare reform goes back to 1976, when I was in the California Assembly. At that time, we had a medical crisis in California, and basically rural California couldn't get healthcare anywhere, anyhow. Basically, everything was getting shut down or disappeared. The Rural Health Act, which I authored that year, opened a series of clinics across the state of California. Over the years, California, and indeed this nation, has worked diligently, not always successfully, but diligently to try to figure out systems to provide health care for everyone, whatever their situation might be. And so those rural health clinics have now morphed into the federally qualified healthcare clinics that do provide service across the state of California in rural as well as urban communities, and certainly extraordinarily important in the Central Valley of California. So what we're now finding is that the effort of more than 50 years of developing programs, some state, some federal, often a combination of the two, to provide healthcare service to everybody that needed healthcare, is now going to be unraveled, destroyed by the big, ugly bill. The president likes to call it beautiful. There's nothing beautiful about setting up a system in which healthcare services are going to be disappearing, and particularly in the Medi-Cal, we call it Medicare, which we call Medi-Cal in California. Those systems are going to get decimated. We know that maybe as many as 14, 15 million Americans will lose access to healthcare as a result of the legislation that is now in the Senate and likely to come back in the House with minor modifications, some of which may actually make it worse. So we've got a big fight on our hand. It's incredibly important that the public understands what is at stake here. Now, just the political argument is, so why are we reducing the Medicare programs or Medicaid programs by as much as $800 billion? Well, to finance extraordinarily large tax cuts, tax breaks for the super wealthy. Now, I'm all for tax breaks for the working men and women of America, making $200,000, $300,000, $400,000 less. Yeah, you deserve a tax break. But if you're a billionaire, you don't. Musk does not need a tax break. But that's why these cuts are being made. So what are we going to do about it? Well, we're going to call out those representatives, and I'm going to use that word again, representatives, who have decided that they want to destroy the healthcare programs that their communities and indeed their constituents rely upon. A couple of examples. Mr. Valadeo in the southern San Joaquin Valley. He has as many as 544,000 of his constituents. These are people he's supposed to represent who stand to lose their health care as a result of his vote in support of this big, ugly legislation. Mr. Kiley, further north up in the Sierra Nevada mountains, east of Sacramento and all the way down the Sierra Nevada mountains, he has as many as 212,000 of his constituents that stand to lose their health care service as a result of his vote for the big, ugly bill. And let's keep in mind, these are very, very close votes in the House of Representatives. This legislation passed by one vote in the House of Representatives. If these two representatives actually represented their constituents, that bill would have failed. But it didn't, because they chose to stand with Trump, to stand with Republicans, and ignore the needs, desperate needs, of their own people that they're supposed to represent. So here we go. We got a major fight. The Senate is working on this right now, not likely to improve the situation, that is to provide better healthcare services, likely to make it even worse. And well, I guess if you're a billionaire, you're making, I don't know, $1 million a year on your income, well, you'd like to have that tax break at the expense of those who are in desperate need of healthcare, losing their healthcare. So with that, I look forward to whatever questions, and I'm looking forward to the comments of my colleagues on this call.
Thank you so much, Congressman. I really appreciate that you highlighted this bill passed by one vote, which means any single one of these folks, Kevin Kiley, David Valadao, or also Ken Calvert and Young Kim in the South, could have flipped their vote to stop this. And also, it's coming back to the House for final passage, so they still do have the chance to do the right thing if they're willing to fight for their constituents and make sure that they have the care that they need. I'm now going to pass things over to Dr. Roy, a cardiologist from Southern California.
Thank you so much, and thank you, Congressman, for your leadership on the effort to protect our most vulnerable Californians. I think that a few points. I serve in a hospital that serves South LA. And so we serve communities of color. We serve, the most vulnerable populations in California. And they're under assault in so many ways right now, as we've seen on the news, with the ICE raids, and Marine deployment and those kinds of things. And then that takes the spotlight out of the attacks that Big Beautiful Bill brings, and that's specifically the attacks on Medi-Cal. And so not only are so many of our constituents in urban areas, rural areas of California living in fear, but they're also living in fear of losing their already inadequate healthcare access. And that's not just unjust, but it's fiscally unwise as well. What this does is basically it shifts the cost from the federal government to the states and to local governments. And so Californians and the constituents in these districts are all going to feel that fiscal hit because these are taxpayer costs that we are going to end up paying either at a state or local level. And then additionally, everybody is going to feel this. It's not just our most vulnerable communities, including about half of California children. But what's going to happen with these Medicaid cuts is that at hospitals like mine, which are predominantly Medi-Cal patients, wait times in ERs are going to go from hours to days. And what that will do is going to affect the wait times for patients with Medicare, patients with private insurance. So it is not simply affecting our most vulnerable Californians, it's affecting all Californians. Everybody will see a decrease in healthcare access, an increased inability to see your physician that you want to see, whether it's primary care or specialty care, in a timely fashion that serves your needs. And then, God forbid that you need to go to the emergency room or need inpatient services, it will, affect wait times and the quality of care there. And so this big, beautiful bill is going to drastically impact the healthcare of all Californians, not just our vulnerable communities.
Thank you, Dr. Roy. I I completely agree about how this is going to affect all Californians. There are so many folks who don't think that these cuts will affect them, but especially if you live in the Central Valley, which is already seeing a number of medical providers shut down, hospitals closing. Madera County just lost its only hospital. Medi-Cal cuts are going to make that worse. But also, many people rely on Medi-Cal to pay for long-term housing once they're, getting older. About a third of long-term care is provided through Medicaid. And once we start seeing these cuts, that could get much worse. Now I want to pass things over to Dr. Erica Rishamvam, who's a physician in Davis, California.
Yeah, thank you so much, Matt, and thank you for the opportunity for me to speak here today. My name is Erica Rishamvam, and I'm a family physician, and I work at CommuniCare Ole, and I'm the medical director at our clinic in Davis, California. And CommuniCare Ole is one of the federally qualified health centers that Congressman Garamendi mentioned. This means we provide the healthcare safety net for our communities in Yolo, Napa, and Solano counties. And we serve about 70,000 patients, and of those, most depend on Medi-Cal. 75% depend on Medicaid, or as we call it here, Medi-Cal, for their healthcare, and an additional 5% rely on Medicare for their healthcare. So this is just in our organization alone, 56,000 of our friends, family, neighbors, of the workers in our communities that depend on this, on Medi-Cal for healthcare. And the proposed extreme cuts to Medicaid would be absolutely catastrophic for our patients, our health centers, and really the entire safety net across California. And in the past 10 years in California, we have seen a decrease of the rate of uninsured Californians from 17 to 6%, largely thanks to the expansions in Medi-Cal that we have seen. And we have witnessed every day in my clinic, in our clinics, what that means for the lives and the health of these individuals and of these families when people do transition from not having insurance to having insurance, such as gaining access to medications, specialists, surgeries, keeping people out of the ER because they can access preventive care services earlier, and just stay healthier. And when individuals do not have insurance, we still do our absolute very best in primary care, in our health centers to care for these individuals. But it is very difficult for us to not be able to connect our patients to specialty services or surgeries that they need when they cannot afford the medications that we recommend, that I know that they need. Or when they are diagnosed with late-stage disease, such as cancer or kidney failure, strokes or heart attacks, because of their lack of insurance that brought them in for care way too late. This is devastating for these individuals and these families, and it is certainly also devastating for us as healthcare workers and should concern all of us as a society when people do not have access to timely healthcare in California. And these proposed Medicaid cuts are suggesting for us to go back to a system where a much larger number of Californians would not have access to healthcare. And roughly half of all the primary care visits in Medi-Cal happen in health centers like ours. And health centers like ours do see everyone regardless of the ability to pay. However, we do need to acknowledge that roughly 70% of our revenue comes from reimbursements for direct patient care. And the vast majority of that comes from Medi-Cal. And cuts to that funding would be absolutely catastrophic for our ability to operate. And that is true for the entire safety net in California, not only for federally qualified health centers, but also for other rural health centers and rural hospitals, and particularly who depend very heavily on Medicaid for their funding, or Medi-Cal here. Safety net clinics typically operate with very thin margins as everything gets directly reinvested into staffing and services for our patients. And if we anticipate that a quarter or a third of our patients lost Medi-Cal and our revenue shrunk by those same margins, you can imagine the devastation that will cause to even the healthiest of organizations in California. And as healthcare workers, we always want to reassure our patients and our communities that we will be there for them, that we will care for them. And this is because we care. We very deeply care about our communities. The reality is, however, that we have been bending over backwards to make a system that is far less from ideal work for people, for us as a healthcare system, and asking us to bend over backwards even more just may break our backs and the backs of our entire healthcare safety net in California. We urgently needed more resources and a better system, and not having fewer resources and a worse system. And as clinics and hospitals and emergency rooms may have to close down or drastically limit services, especially in rural areas, this will affect all Californians, as Dr. Roy has also pointed out, and Congressman Garamendi, not only those on Medi-Cal. It will devastate the services to people with disabilities and all those depending on long-term care, and it will have far-reaching consequences for our entire healthcare safety net system and our entire society, including here in California. It's absolutely unconscionable for me how representatives like Kevin Kiley and David Valadao, whose constituents and health centers and hospitals in their districts depend on Medicaid in very large numbers, would decide to vote in favor of such devastating cuts. And we, as healthcare workers, we bend over backwards because we care, but clearly those who voted for those cuts do not care. And I appreciate that Congressman Garamendi and your colleagues are working hard against these cuts. And I thank you for all that work, and I appreciate the work Protect Our Care California is doing and the opportunity to speak. Thank you.
Thank you. To pull things back a little bit, House Republican messaging started off saying, we're not going to cut Medicaid. And then it transitioned to, well, actually, we're just going to be adding work requirements. And then a CBO score came out that said 16 million people would lose their health care if this bill passes, and 24 million people would see higher premiums. They realized they were losing the fight, so they pivoted back to, don't worry, there's no Medicaid cuts in this. And if you're saying that 16 million people are going to get kicked off Medicaid, but it's not a Medicaid cut, like, I'm sorry, words have meanings. That's a goddamn lie. And David Valadao has been at the forefront of trying to say that he cares deeply about Medicaid, but also that he's fine passing this draconian bill that's going to kick so many of his constituents off of Medicaid. It's a shame, and I think there should be more accountability for folks like him who stand up and lie straight to their constituents' faces, right? I've spoken with countless people who called into his office and said, I'm worried about these Medicaid cuts, and we're told, don't worry, it's going to be fine. And we're seeing now 16 million people could lose their health care if this passes. There needs to be a reckoning for the members of Congress who help make this possible. And we need to make sure that they know about that so that they are less likely to vote on final passage. Now I want to open things up for the floor. I know, Rachel, you've been seeing if there are any questions. If you want to get started on that.
Of course. Thank you, Matt. And thank you, everybody, for joining us today and participating in this really important conversation. For our press who have joined us today, if you have any questions for our speakers today, please put those in the Q&A box at the bottom of your screen. And if you have a question directed towards a particular speaker, you can please note that in your question. And if you are watching today on Facebook and have any questions for our speakers, you can put those in the Q&A, or I'm sorry, in the comment section, and I will be monitoring that as well. Now, our first question was submitted ahead of time, and that question is for Representative Garamendi. Representative Garamendi, you recently wrote a scathing op-ed about the GOP Medicaid cuts. What made you take such a bold step?
There's nothing bold about calling out the truth. The fact of the matter is, my colleagues from California, who have a very sizable number of their constituents, are going to, they've simply ignored the needs of their constituents, and they need to be called out. I would expect to be called out if I was on the wrong side of this issue. I have 330,000 of my own constituents who stand to lose their healthcare services as a result of this legislation. And I want to just add here, healthcare is, right now we're talking medical, but this legislation goes far, far beyond just the medical piece of it. There is a very sizable, some 18 million Americans are going to lose access to food. which is a rather important part of our life, and the health and the mental health services that are necessary for younger people in schools, high schools, and also the elementary schools, those mental health services will simply disappear. So across the board, school lunch programs, the SNAP programs, food that's necessary to keep people going, as well as the healthcare services, those are going to be significantly less, and many places they'll simply disappear. So the services that people rely upon to stay healthy, to be mentally able to deal with the complexities of their life, not going to help, not going to be there. So this is a terrible, terrible bill. We've used the word big, beautiful. Please, this is big, ugly. This is about the ugliest, worst bill that I've seen in my many, many years of public policy. And it may very well become law, and it will be devastating.
Thank you, Representative Garamendi. Looks like we have another question. That question is for Dr. Roy. And that is, Dr. Roy, do you get the sense that your patients are worried about these cuts?
I do. I think that, my patients who are, Medi-Cal patients, and, I want to reiterate, 50% of California children are on Medi-Cal. That's 50% of California families have somebody on Medi-Cal who's receiving their healthcare through Medi-Cal. And so this affects such a broad swath of Californians. And my patients are feeling under attack in so many ways from this administration. And Medi-Cal and healthcare access, something that we've made a lot of progress on over the last 10 years. They feel like they're going back to the days of pre-Affordable Care Act. With the Affordable Care Act and the Medi-Cal expansion, I think many of us forget what it was like before then, in terms of ER wait times, hospitals going out of business across the country, including in districts like in rural California. And that's what we're going to see here. If this bill passes in the way that it's going to pass, is we're going to see hospitals go out of business. We're going to see decreased options for all of our patients again to seek medical care. And it's going to be bad in both rural and urban areas. And I think that, my patients, I think most Californians want representatives who stand up for them. They don't care about the politics. They don't care about the rhetoric, but they just want, they want representatives that stand up for them. And the only representatives who should be, voting for a bill like this is if their district is full of corporations and the mega affluent. But if you have working people in your district, the vote on this bill should have been no.
Thank you, Dr. Roy. Now, those are all the questions we have for today, so I will turn it back to Matt, but I also invite any of our participants on today's call, if you have any follow-up questions, feel free to reach out to Matt. All right. Thank you.
Thank you, everyone, for joining, both our speakers and the reporters and TV crews that are on the Zoom. This is going to be, a big fight over the next 2 months. I'm sure you have a ton of coverage planned for Medicaid. Protect Our Care is happy to be there as a resource if you need stats on a particular district or a particular county, how it would be affected by these Medicaid cuts. We can provide those. If you're looking to speak with folks who are on Medi-Cal who could lose coverage if these cuts are passed, we can make those connections. Do reach out. We are happy to be your partners in your ongoing coverage. And I want to close just by saying, I lived in Kevin Kiley's district for 2 years, about 5 years ago, and I knew so many folks that relied on Medi-Cal, and his district is not even the highest percent of Medi-Cal population in the state. It is something where so many folks in California rely on Medi-Cal and could see their coverage taken away. 16 million people nationwide is a big, scary number, but in every community that looks like, hundreds of folks who could lose their coverage. In Roseville, where I used to live, or in Bakersfield, where Valadeo represents, there are real human stories of folks who would be impacted by this, who'd have to make tough choices about, are they going to go to the doctor to get this treatment plan that they might not be able to pay for, or are they going to go to the grocery store to make sure they can put food on their table? Especially with, as Representative Garamendi noted, the cuts to SNAP that are going to make it even tougher for working class families to afford nutritious food. This is, a real devastation will come for California if this bill passes. So just let's never forget that human impact that we'll see for millions of people in California. Thank you, everyone.